The middle range theory that we'll be speaking about today is adapting to diabetes mellitus. The practice specialty is primary care, specifically primary care of veterans. So the chosen theory addresses each of the four meta paradigms of nursing. The first, the theory addresses that each person is an adaptive system, whereby the individual is described as a whole composed of parts that function as a unity for some purpose. In this example, the person is functioning to survive, so survival is their purpose. The theory addresses environment in that the patient's response to the environment, which results in survival, growth, mastery, and reproduction. In this case, the patient wants to survive, therefore they use the teachings of the theory to grow and master techniques of treating their diabetes. They reproduce these things to continue to adapt to the treatments of the chronic illness. The theory addresses health in that it is a state and process of becoming whole and integrated in a way that reflects person and environment mutually. The patient cannot be whole until all aspects of their health care are integrated in a way that promotes whole health. With the VA, we promote whole health to everyone. The theory addresses nursing in that the goal is to promote adaptation in each of the four modes, thereby contributing to the person's health, their quality of life, or their death with dignity. The nurse's responsibility in this case is to contribute to the person's health by contributing to their quality of life, by teaching them how to adapt to their chronic illness, which in this case is diabetes mellitus. This practice fits well within my practice setting because in my current position as a patient-aligned care team care manager, diabetes management of my panel of veterans makes up about 30% of what I do each day. That includes appointments. The veterans come in just to see me so we can do diabetes management. Each month I have to run a report that tells me which of the veterans on my panel has an A1C greater than 9. These patients are usually the ones who are non-compliant, but some of them they're new diabetics that haven't adapted to their treatment yet. This theory fits well because it gives me ways to better educate my patients, whether it be new techniques or how to word things specifically to make them understand or to make them more agreeable to the treatment plan. Concepts in this theory that could directly influence my patient's care. Weekblad identified that when participants wholly combined behavioral strategies, so with psychological strategies and social strategies, that they demonstrated a higher self-esteem, and they subjectively reported good health and had lower A1C levels. The veterans need to accept in their mind that the diet behavior that they are exhibiting is hindering their progression. I have one veteran who says that he can't stop the carbs because he doesn't want to be rude in social situations, such as when his large group of elderly friends goes out to eat 3 times a week. If I can get my veterans to balance all of these things, I feel like it could help them adapt and we could obtain lower A1Cs on them going forward. This is called health within illness. The last concept that can directly influence my patient's care is self-management and health-promoting behaviors. This is very important in adapting to a chronic illness such as diabetes. If I can get my veterans to actively participate in the self-management, then this will contribute to a physiologic and a psychosocial adaptation of their chronic illness, and therefore we can obtain the lower A1Cs and a better treatment of their diabetes. Thank you.